Good morning, colleagues, collaborators, and friends of the GMSH. My name is Dane Griffiths, Director of the GMSH, and I'm delighted to welcome you to our 2021 very first virtual conference. I thought about opening up this conference with a line from our favorite viral video over Pride this year, which was just, "Hi, gay," but then thought I better come a little bit more prepared. At the GMSH, we're on a mission to ensure that gay, bi, and queer men in Ontario understand the realities of HIV today and can take full advantage of every advancement in HIV and sexual health, now and into the future. We're doing this by producing quality digital content and resources that bridge a gap between public health messaging and the conversations we have in the community. You may have noticed, but if the GMSH has a voice, it's that of your knowledgeable queer bestie. Over the years, we've developed as a space for shared learning and skills development among our Alliance members and among colleagues in the response to HIV, where the latest information about HIV and sexual health is unpacked and put into frontline practice. And along the way, we're looking to put a little bit more fun and joy into all of the work that we do. I've watched with excitement the emerging talent and dedication of our Alliance members, especially during these COVID times. And let's be honest, there's been some surprises over the last couple of years. Who knew we would ever see public health guidance on glory holes? I mean, it's astonishing. But we're not without challenges in our work. COVID-19 is still part of our lives with unique impacts on Black and Brown bodies and on Indigenous communities. And it's propelling us for more equitable approaches in our response to HIV and challenging systemic racism where it shows up in our healthcare system, in our sector, and in our communities. Clinic closures and disruptions in care presented challenges for queer men who want to do the very things that we encourage: early and frequent HIV and STI testing, the use of prevention tools like PrEP, and engagement in care. Our Alliance members generating solutions in their work in these challenging times was a bright spot over the last number of months and years. As we'll learn over the next month, continued focus is needed on the HIV prevention, treatment, and care needs of gay and bisexual men in the province, as well as attention on other sexually transmitted infections like hepatitis C, and addressing the systemic challenges experienced by gay men at every step of the HIV cascade. Now, the last time we had one of these events was in 2019. And let's be honest, there's no substitute for meeting in person. We get that, and we hope that wherever you're joining us from, you'll get a lot out of this experience and connect with this year's content. And what a lineup we have. GMSH 2021 spans 11 days, 21 sessions, and over 50 incredible presenters. Week 1 provides a chance for us to learn more about how newly available tools like HIV self-testing are finding their ways into the lives of gay men. We'll see the latest numbers on where we're sitting and where we're making progress in the response to HIV and where more focus is needed. This Friday, HQ is hosting. Okay, not literally, but they'll be here and we'll be here to learn more about this gorgeous new home for queer men's health in Toronto. Week 2 brings with it lively discussions with physicians on standards of care for gay men, policy experts on priority issues like HIV criminalization, mental health, and the toxic drug supply. We'll hear from colleagues in the UK, the fabulous team of Prepster, who are going to offer lessons for community mobilization. And we round things out with a look back at 40 years of HIV treatment advocacy and ask what's next for HIV activism. Week 3, you don't want to miss a first look at findings from the Trans Interweaving Project and what it means for the GMSH and our sector as we look to more meaningfully engage trans and non-binary people in our work. A plenary panel on queer Black resilience post-HIV, and a contemporary dance performance and engagement with choreographer Kevin Ornsby. In a few weeks' time, Take some time for self-care by joining us on November 8th to explore and practice mindfulness and stay engaged as we close out the conference with learnings on two-spirit health and wellness and a closing plenary by global gay men's health and human rights advocate, Dr. Andrew Spieldenner. We want you to enjoy these next 4 weeks as best as you can. So I encourage you to join as many sessions as you can and to keep your cameras on for as long as it's comfortable. You can follow along on GMSH social media on Twitter, Facebook, and Instagram, and use the hashtag GMSH2021. Some quick housekeeping items. You can view the full conference agenda in the corner of your screen in this virtual space, and even add sessions directly to your calendar so you don't miss a beat. Sessions take place either on this main stage or in Zoom. Visit the speaker showcase to learn more about all of our presenters this year, and head on over to the art gallery to see work by some incredibly talented contributors to GMSH content and resources over the last little while. HIV shows up in our lives in our bedrooms, on apps, in the back rooms of bars, the small rooms of bathhouses, and in the places we cruise and access services. We resist any sanitation of sex and its focus on danger and disease. Instead, the approaches of the GMSH look to empower, uplift, and celebrate all of the intersections of sexual identity and expression. More than ever, we feel it's critical to put sex back on the agenda in our work, centering connection, pleasure, and play, regardless of our HIV status, and bringing to the table what's often denied to queer people: positive and affirming sexual health messages by us, for us, and in service to all in our communities. It's been 40 years since the first lives in our community were changed forever by HIV and AIDS. We find ourselves today in such a hopeful time, with tools to diagnose HIV faster and earlier, to PrEP, and the undeniable fact that undetectable equals untransmittable. 40 years of love, loss, and resilience got us to this place and continues to inspire us in our work. Especially during COVID-19, the wisdom of gay men living with HIV, proudly letting us know that this wasn't their first pandemic, provided for meaningful intergenerational connectedness that's critical to our work. Each of us should be able to enjoy the greatest sex and intimacy we can and live freely from stigma, shame, persecution, and anything that stands in the way of us actualizing our best lives as queer people. This conference wouldn't be possible without the continued support of the AIDS Bureau at the Ministry of Health and our trustee, the Ontario AIDS Network. I want to offer our thanks, and I look forward to continued collaboration with you. To the GMSH team, Devin Nambiar, Adam Awad, Eric Peters, Christopher Millay, and Jordan Bongor for all of their hard work putting together this conference, especially in a virtual space, which poses its own challenges and opportunities. To our presenters and moderators, thank you for continuing to support the work of the GMSH and for taking the time to join us. And last but not least, to the fabulous team at King Events who put together this beautiful virtual venue. It's been a real pleasure working with you, and I hope we can again in the future. I'll be back, but I'm going to turn things over to Adam Awad, our Manager of Communications at the GMSH, who has a special message for our Francophone colleagues and friends. Thank you.
Hi folks, salut tout le monde. Je m'appelle Adam et je suis le directeur des communications à l'Alliance. Comme Dane a dit, on a le mandat d'améliorer la santé sexuelle des hommes gays. Et en fait, par hommes, on parle autant d'hommes cisgenres et transgenres que les personnes non-binaires transmasculines. Présentement, on s'assure que les hommes gays comprennent que les traitements et les méthodes de prévention du VIH ont énormément changé au cours des dernières années. Et en produisant des ressources et du contenu numérique de haute qualité, on combine la recherche scientifique, les messages de santé publique et les conversations réelles qu'on a entre nous dans la communauté. Depuis notre création il y a 11 ans, c'est devenu un espace où nos membres peuvent apprendre et perfectionner et où on décortique les dernières sur le VIH et la santé sexuelle pour les mettre en pratique. Comme votre meilleur ami queer, la voix du SSHJ est sage, joyeux, sans préjugés et d'un grand soutien. Même si la conférence est en anglais, notre équipe travaille fort pour trouver des façons de mieux servir les francophones dans la province et les membres qui travaillent en milieu francophone. On sait que la norme n'est pas assez, en particulier pour un organisme basé à Toronto. On peut plus simplement traduire des matériels créés pour un public anglophone et majoritairement blanc. On doit créer des ressources et des matériels qui s'appliquent au vécu des hommes francophones queer sans y penser après coup. Comme le travail avec les hommes trans, queer, les hommes gays noirs et les amateurs du chemsex, on doit les impliquer dès le début. C'est pourquoi notre priorité sera la rédaction de nouveaux matériels en français, l'entretien de ressources professionnelles francophones dans le secteur et la collaboration avec des chercheurs, des auteurs, des fournisseurs de services et des artistes francophones. Au cours de la prochaine année, vous allez voir du contenu qui reflète la diversité des communautés francophones en Ontario et des besoins des hommes gays francophones. Ça fait 40 ans que les premières personnes de notre communauté ont été touchées par le sida et le VIH. Aujourd'hui, on se trouve à être beaucoup plus optimiste. On a des meilleurs outils pour dépister le VIH plus rapidement. On a le PrEP et on sait maintenant que indétectable égale intransmissible. Et après 40 ans d'amour, de perte, de résilience, on est toujours là. Et notre histoire inspire toujours notre travail. Même pendant la COVID-19, la sagesse des hommes gays vivant avec le VIH nous a rappelé fièrement que ce n'était pas leur première pandémie. Cet encouragement nous a aidés à créer des liens intergénérationnels très nécessaires. Chacun d'entre nous a le droit d'avoir des expériences sexuelles et intimes sans stigmatisation, honte, persécution ou obstacle. On mérite de vivre notre meilleure vie en tant que personne queer. Et donc, merci beaucoup. J'espère que la conférence passera bien pour tout le monde. Et on est hâte à vous voir à la prochaine. Thanks, everybody. And I'm going to pass it over to Joanne Lush from the
Hi, welcome everyone. Bienvenue. A big thanks to Dave and his team for including us as part of the opening here today. Ken English and I are both here at this event today and hope to be at a couple of things. And I guess as we start in this new world, I say welcome to my home as we continue to all work somewhat remotely and not. These last 18 months have been an extremely challenging time for everyone, and even more so for racialized community members that have borne the disproportionate impact of COVID-19, coupled with increasing and ongoing anti-Black racism, as well as anti-Indigenous racism, anti-Asian hate, and Islamophobia, among others. We recognize the additional stress this has played on many of you in your work and personal lives, and I want to thank you and recognize your ongoing dedication to the work and to the communities that you serve. COVID-19 has highlighted issues of health equity, health literacy, the social determinants of health, and elevated the conversation around the importance and value of race-based data as important indicators and measures of health outcomes and equity. We have always valued the importance of this for evidence-informed decision-making, policy directions, and programming, and it continues to remain a priority for us at the AIDS Bureau. Of course, COVID's also brought other challenges to the forefront: varying access to technology, food and employment insecurity, decreased services, including HIV and STI testing in the community, and then the ongoing opioid overdose crisis and opioid-related deaths, which have significantly increased over the past 18 months. During the pandemic, we saw that our sector was resilient, creative, flexible, adaptive, and collaborative. I appreciate the way in which Alliance members were able to pivot your programs, services, and approaches to reaching and serving GBMSM across the province. And this event today is an example of where GMSH has also been able to deliver on programs differently, yet still deliver. When I reviewed the agenda for this event and in reviewing many of the individual ASO program plans, I was encouraged to see the alignment between our office priorities and the priorities in the sector. While there is great optimism in the new technologies available to fight HIV and much anticipation of life after HIV, we must continue to maintain our current focus and prioritizing the elimination or reduction of HIV, especially its differential impact on some populations. And we must ensure folks with HIV receive the comprehensive care and supports they require, as well as the quality of life they deserve. An important part of that continuum of care includes HIV STBBI testing, PEP and PrEP access, sexual health education, online outreach, and ongoing harm reduction supports. HIV and STBBI testing rates have been significantly impacted by COVID. At one point in the first wave and the first closure, about a 75% reduction. It has varied throughout the last 18 months, of course, depending on the healthcare system and the different waves and closures. And we're only now reaching 2019 testing rates. A number of our anonymous testing and point of care sites are still sidelined by work on COVID, as they are often located in health units. So there is much work to be done to ramp up testing across the province. Our goal is to reduce the estimated 15% of all HIV positive people in Ontario who are undiagnosed and connect them to care through a number of HIV testing activities. The Ontario HIV Treatment Network Get a Kit self-testing initiative, I'm sure many of you are engaged and aware of it and are likely going to hear more about it later. Many of you are involved in the REACH Nexus I'm Ready study. We're working on updating our testing guidelines to recommend that providers do more frequent HIV testing of all priority populations and earlier testing at 3 weeks after exposure. We're supporting some testing pilots, a pharmacy testing pilot in Toronto and some ER testing pilots in London, Thunder Bay, and Toronto, and then the establishment of HQ in Toronto. GMSH workers have an important role to play in raising awareness about HIV testing in your communities, both amongst clients and providers. Testing can and should be a gateway to either treatment or to prevention services. Implementing a status-neutral approach ensures that more proactive supports and resources are provided to both the newly diagnosed and to those who test negative. Either pathway should be connecting people to other levels of care as needed. PrEP and the Ontario PrEP.ca program are central to this proactive approach. 9,600 people were dispensed PrEP in 2019, a very large increase from just 3 years ago. We know we can reach more people and more providers, and you are key players in raising awareness about the vital role PrEP and PEP can play in reducing HIV transmission. You can actively support referrals to the PrEP Start program as a way to pay for the first few months of being on PrEP until other arrangements are made. Beyond HIV testing and PrEP or PEP, you have an important role to play in raising awareness in your communities about other STIs, especially syphilis, and the importance of not only HIV testing, but STI testing when testing for HIV. How this work happens also matters. While in-person engagement may be considered the most effective way of reaching folks, online outreach is highly effective in reaching GBMSM. The online tools, social media, and the many resources GMSH provides assists you with this outreach work. We also know in our communities that a number of GBMSM are negatively impacted by substance use, which puts them at higher risk of acquiring HIV and other STIs. GMSH has developed resources and information about substance use, the P&P campaign, and GMSH workers are well positioned to respond to the nuanced culture of drug using in the GBMSM community. Finally, you will hear more about the innovative and collaborative HQ model in an upcoming session. We have supported the development of HQ and are pleased to see that Toronto AIDS Service Organizations, the Ontario HIV Treatment Network, and other healthcare providers are working together to ensure it is an inclusive and welcoming space for two-spirited GBMSM, including trans people. Our prevention goal of reducing HIV incidence will be achieved by the delivery of stigma-free sexual health, testing, mental health, and HIV-related care, and sharing best practices across that network. As I think back over the 40 years of HIV, I note many things for myself. What comes to the forefront is both the pain and the hope. Sometimes these states coexist, and other times one takes a stronger presence. There continues to be an ongoing and significant burden of HIV among gay and bisexual men. While rates have decreased, GBMSM still represent over half of all first-time HIV diagnoses in Ontario. Within the broader HIV risk population, we are seeing some reduction in the rates of HIV in white men and concerning trends about HIV rates in racialized men. The Latin, Black, Asian, and two-spirited Indigenous populations are adversely impacted by the social determinants of health, racism, intergenerational trauma, homophobia, social marginalization, substance use, precarious immigration status. These conditions often combined produce an overlapping syndemic vulnerability to HIV and STIs that needs our focus. This requires research, epidemiology, and local community knowledge of how these syndemics differentially impact populations of GBMSM across the province so we can build a more tailored response. There is hope. We have tools now to help significantly reduce the burden of HIV in our communities. We have new testing technologies that permit earlier diagnosis, and we have greater access to testing, for example, the self-testing work. We have PrEP, and we have ongoing refinements to HIV treatments that make it easier to manage medications and maintain an undetectable viral load. And you all know the transformative power of the U=U message. Together, we all need to ramp up these tools by understanding better the challenges associated with accessing them, the impact of the social determinants of health, as well as geographic and logistical barriers across the province. We've seen efforts to destigmatize HIV, yet we also see there's much anti-stigma work to do. I'm ever mindful of the resiliency and tenacity of gay men, in particularly over these 40 years of HIV, to develop innovative and creative ways of responding to the epidemic and lessons learned that have carried forward. I want to recognize the work of GMSH, in particular, the informative and very engaging social media and other resources that GMSH has developed and shared in the last year that acknowledges how the HIV movement has changed and what's been achieved in the past 4 decades. As I end today, I continue to applaud your work. I also challenge us to escalate the focus of our work on all populations of gay men, specifically Latin, Black, and Two-Spirited people. It will be important to continue working with all sector partners to strengthen our response, including the translation of GMSH resources, continuing the ACHO and GMSH collaborative capacity building initiative for workers, for those working with Black GBMSM, and work to strengthen services for Two-Spirited community members. The agenda for this event is impressive. There are a lot of sessions. I encourage you to take your time to access them, to reflect, and to really think of how it can improve and further our work. So thank you very much for this opportunity today. And I look forward to learning more throughout some of the sessions. Thank you.
Thanks so much, Joanne, and thank you, Adam. Like many organizations, the GMSH observed the first National Day for Truth and Reconciliation on September 30th. Across Turtle Island, Two-Spirit and Indigenous people are walking paths of healing and reclaiming what was taken over hundreds of years of colonization, including culture, language, spirituality, and entire ways of knowing and understanding gender and sexuality. To start us off in a good way, I am honored to introduce our opening keynote speaker for GMSH 2021, Jack Saddleback. Jack is a proud Cree, Two-Spirit, trans gay man from the Samson Cree Nation in Musqueam, Alberta. Former president of the Saskatchewan Students' Union, Jack was the third Indigenous person and first transgender person to hold that role. As an internationally renowned public speaker, activist, and equity champion, Jack is a staunch advocate for Two-Spirit people, Indigenous engagement, gender and sexual diversity, equitable policies, and social stewardship. Jack, thank you for joining us.